Welcome to The Explainer. Today, we're diving into a real-time medical mystery. We are tracking a massive foodborne illness outbreak linked to something called Cyclospora. It's basically a high-stakes puzzle, and right now, health officials are in an absolute race against the clock to find this invisible culprit hiding in our everyday meals.
Okay, let's dive into this. We need to start with the very real, visceral human experience at the center of this whole thing. Because, this isn't just about supply chains or boring data points. It's about people. Take Jessica Murphy-Smith, for example. She's one of the victims, and she described the feeling like this. It felt like there was a lead ball in my stomach. I mean, wow. That is an incredibly vivid way to describe the intense physical pain that people caught up in this outbreak are just suddenly waking up with. It completely derails their lives. And understanding that human impact, that is absolutely crucial to grasping the high stakes of this investigation. And the thing is, Jessica is far from alone here. 7,000. Just let that staggering number sink in for a second. That is the suspected nationwide scale of people who have been sickened by this exact same outbreak. Imagine thousands of people across the country, all suddenly experiencing that same awful lead ball feeling in their stomachs, totally unaware of what they even ate to cause it. It's a massive epidemiological event.
To really wrap our heads around the dramatic tension of this investigation, we have to look at the huge contrast between what we know for sure and what we suspect. On one hand, investigators have pinned down a very specific, confirmed regional cluster. We're talking 43 known cases concentrated right in Michigan, which, by the way, includes Jessica. But on the flip side, the suspected national spread balloons to nearly 7,000 cases spread out across 34 different states. So health officials basically have to bridge the gap between that localized cluster and this massive, sprawling national web of illnesses.
So, what exactly are we dealing with here? The culprit is a foodborne illness called cyclosporiasis. And guys, this is not your standard 24-hour stomach bug, not even close. It's caused by a microscopic parasite that is notoriously difficult to wash off produce. And the worst part? It results in weeks of severe intestinal distress. Literally weeks. That extended time frame of just pure suffering is exactly why public health officials are treating this with such immense urgency.
Section 1. Tracing the lettuce source and the FDA investigation. Now, to see why tracing this is so incredibly difficult, let's jump back to Jessica Murphy-Smith's timeline. So she generally ate bag salads once a day, but she remembered a very specific event. She had a cheat day at Taco Bell, and she ordered 2 tacos with lettuce. But here's the kicker. It wasn't until a whole week later that she actually started feeling sick. That delayed incubation period makes tracking the source an absolute nightmare. Just think about it. Imagine trying to remember exactly what you ate and where every single ingredient came from a full 7 days after the fact. Now, what's really interesting about this is despite that massive delay, the FDA's trackback investigation has actually uncovered a prime suspect. They've managed to identify a single supplier of iceberg lettuce operating down in Mexico. And according to the investigation, this specific lettuce was sold to Taco Bell by a company called Taylor Farms. This is huge because it finally gives investigators a highly specific target in the supply chain to focus all their efforts on. However, as you might guess, tracing epidemiology is a really slow, meticulous process. While they have identified this suspect lettuce, so far it's only been officially linked to 5 states, mostly in the Midwest. So we've got this tight official link in 5 states, but remember, we still have that massive looming mystery of the suspected 7,000 cases across 34 states that we talked about earlier. The puzzle is definitely coming together, but the picture isn't entirely complete just yet.
Section 2. The corporate response and taking action. Taco Bell actually moved really quickly once they heard the FDA's findings. They put out a statement declaring the infected ingredient from our supplier is being indefinitely removed from our supply chain nationwide. They are taking swift precautionary action, basically yanking the questionable lettuce from their menus to get this thing under control. And on top of that, they're actively encouraging all other restaurants, retailers, and food service operators to do the exact same thing, just to be totally safe. Now, looking at the supplier side of the equation, we want to impartially report the facts of the investigation here. It's important to note that so far there has been no official response from Taylor Farms regarding these FDA traceback findings. As this whole situation develops, public health officials are obviously going to continue looking for cooperation across every single level of the supply chain. And this right here brilliantly illustrates the very realistic perspective that medical experts are holding right now. As one expert noted, I don't think that the work is done, but that's why I call it the beginning of the end. You see, they point out that, unfortunately, we are absolutely going to see more cases pop up as this whole situation plays out. But there is definitely some optimism. The hope is that we're finally over the rough patch now that the main source has been identified.
Section 3, protecting yourself moving forward and what you need to do. So the crucial point is that doctors say the risk isn't entirely over. Because of that, there are 2 layers of defense happening right now to protect you. First up is the supply chain action. That's companies like Taco Bell indefinitely removing the suspect ingredient to cut off public access to it. But second, and honestly more importantly for you, is consumer action. Because this threat can linger, doctors are strongly recommending that you take matters into your own hands by thoroughly cleaning your produce at home before you eat it. Now, the truly good news in all of this is that the system is actually working. Tracking down the potential source in Mexico puts health officials a massive step closer to containing the parasite and preventing even more cases from devastating families. It is a vital victory in getting this widespread outbreak under control. But we have to leave you with one final, very important thought. As we learned from Jessica's timeline, this illness is incredibly deceptive because it has a long, 2-week incubation period. That means the salad or taco you ate days ago could still be a threat to you today. So think back on your meals over the last 14 days. With a 2-week incubation period, are you already in the window? Stay vigilant, wash your produce, and take care of yourselves out there.